evening, a medical breakthrough at the Hospital for Sick Children and Toronto General has saved a Metro man's life. Kate?
And the breakthrough may represent a new lease on life for victims of a disease called thalassemia. CFTO's Bill Hutchison explains.
Andrea and Stephanie have the most common genetic blood disorder in the world, thalassemia. Their bodies don't produce normal red blood cells. Monthly transfusions help sustain their lives, but they also cause a buildup of iron, which can ultimately cause their hearts and livers to fail. Since 1978, a drug called Desperal has helped lower iron levels for thalassemia patients. But Dr. Nancy Oliveri, an expert in thalassemia at the Hospital for Sick Children, says for older patients like Eugene Fortunato, who didn't have the drug when they were small or who didn't take it every night, death before their 30th birthday was common.
The prognosis for Eugene at that point was 0, and we knew that if we didn't do something, he would die, as had many of his peer group before him.
Dr. Oliveri decided to try something never done before for thalassemia patients, a heart and liver transplant at Toronto General Hospital. That was 3 years ago. Eugene now has a new lease on life, and Dr. Oliveri has written a paper that will be released in the New England Journal of Medicine tomorrow, encouraging other doctors with older thalassemia patients to try transplants.
The release of this paper is more than just information about a successful medical procedure. It's also a desperate plea for more organ donors. Dr. Oliveri admits she's already had 2 of her thalassemia patients die while on a waiting list for a transplant. Bill Hutchison, CFTO News.
It's about the world's most common genetic disorder and a historic transplant for a man who has it. Judy?
And the disease is thalassemia, and the 29-year-old patient is the first anywhere with that condition to receive a new heart and liver. Ironically, his own had been destroyed by a life-saving treatment. Were you very ill before you had the transplant?
Yes.
How?
I was real weak and I was green in color.
What's the difference in how you feel now?
I feel a whole lot better, just like normal, like anybody else.
Eugene was diagnosed with thalassemia at the age of 2. It's a common genetic disorder that leaves the patient unable to make hemoglobin. It's the chemical that carries oxygen in the blood. The only therapy is multiple blood transfusions, but they carry a deadly side effect, an accumulation of iron in the major organs. Hi. There is a way to remove the iron buildup, but it too has problems.
This treatment involves a needle which goes into the skin every night and has to stay there for 12 hours. So it's really difficult for teenagers and young adults to comply with that regular therapy. And Eugene didn't.
Compliance is an issue even for patients as young as this.
She's, well, why do I have to get a needle? When are they going to make the pills? So I don't have to be with the machine and I can stay up and I could be like my sister and all that kind of stuff every night.
In general, it's very difficult to comply with. And that's how people like Eugene, and there are many of them, end up in that situation where they have no hope for their liver and heart, their own liver and heart, to continue functioning.
Eugene is the only thalassemia patient in the world to receive a heart and liver transplant because others died waiting for organs. As more and more medical problems are solved through the use of transplantation, there will be a greater and greater need for donors. So please, sign the organ donor section on your license. At the Hospital for Sick Children, I'm Judy Halliday for City Pulse.